Welcome to today's COVID-19 update. We're, of course, speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you once again for having me on the program.
Yes, sir. As it's in the news, Region 5, Maracaibo, I know that yesterday you gave us an update and you spoke about the importance of working along with the Tushao and the community. And it brings me back to Cubana and how successful the ministry eventually was. And I know the team is planning on going in tomorrow. Could you just tell us a little bit more about why is it so necessary that you work with the community on this?
Well, we need communities' buy-in and participation. Without that buy-in, it's going to be difficult to monitor the situation and give the kind of assistance that is necessary. Having analyzed the results that came out from the weekend's exercise, where we now have 33 cases, we have decided with the regional health authorities that we'll be sending back a new team and possibly we'll have a more permanent presence, at least for the next 2 to 3 weeks, in Maracaibo, where we'll have the capacity to continue doing testing, to monitor these 33 persons who are now in home isolation, and to give whatever other support the community would need. In addition to that, I think the regional authorities, the chairman, vice chairman, would also be going in so that they can talk more directly with the villagers and the village council to get them to understand the importance of this exercise. So we are happy that we are getting the support of the regional administration, and that would allow us to really be able to do an effective job. So I anticipate similar things as we continue to do more testing. We perhaps would find more cases, but eventually once we manage it well, we'll be able to reduce those cases in another couple of weeks.
Okay. I know when the team goes in, you have the COVID curb team as well that goes, and then you have the sanitization as well. What about the contact tracing? I know you're placing a lot of emphasis on that.
Well, when that team would go back in, that's part of the exercise, and we are hoping that the village council would also assist us with the contact tracing. In this case, the village is fairly isolated. You have to travel some distance to get there. But within the community itself, people live some distance apart from each other. So we'll have to find those persons where they're living, give advice to the household how to isolate themselves from the householder who is sick, and try to ensure that minimum contact and so forth, so that we can reduce the spread within the village itself. So I think there's a lot of work to be done, but I think the team is experienced enough to be able to deal with this.
All right. Minister, on a national level, we have seen some increases, but we discussed this last month that this was a possibility given that we were coming out of the holiday season. What is necessary or pertinent for persons to remember? And I think I'm asking the question because people tend to forget that we still have to observe the basics.
Well, as you said, the basics is what is necessary, because you still have to do the social distancing. You still have to wear masks. This is very important. And when you go in and out of a building, because you're touching surfaces and you don't know which surface might be contaminated, it's important that you sanitize your hands. I know this can be burdensome for people. I know it can be fatiguing. People detest doing some of these things repeatedly. But that's what is important. That's what is going to protect you. And the more you adhere to these measures, the better it is for everyone else. And I think that's what we have to keep repeating. It might sound as if we're repeating the same thing over and over. But these basic things, as you call them, is the essential things that would protect people.
All right. I have a few questions from the other media houses, but before we get to those, I wanted to ask you in particular about training. We discussed it last year. We're into the new year. What are some of the training that you have ongoing right now for the healthcare workers?
Right now, we don't have any fixed set of training, but we will be rolling out a number of other training programs during the year. As you know, last year we did complete several types of training. This year we'll repeat some of them but update them because the knowledge that we have on the disease is improving. We did had some exposure, so to speak, about new things that are occurring with the virus. So a number of our the senior staff of the ministry yesterday participated in a WHO meeting where we are looking at the different mutations of the virus. And I think now we are pretty much aware of the types of mutation that this virus has undergone and the various strains that are right now circulating globally. And some of the things that we have to look out for and perhaps the consequences of these new strains that are circulating. So some of our staff was updated with that because they were on the call with the scientists from the WHO. We have also had some specific training discussions with SAGE. This is the Global Scientific Organization experts dealing with a range of issues pertaining to COVID-19. This include vaccination and efficacies of vaccine and immunity protection, a whole range of issues. So again, when our staff attend these sessions, then we use that information to pass it on to the others within the system that is working particularly with COVID. So this is an ongoing thing. Almost every week we are in sessions with the WHO to better understand what is happening with the virus, what new information is coming out globally. And so that's one aspect. In addition to that, we ourselves are crafting new programs, as I said. So we'll be doing new programs for medical doctors who are involved in the direct treatment of COVID-19 patients. And since the disease affects almost every organ of the body, we are looking at specialized sessions dealing with how COVID maybe affect persons with diabetes, how COVID would affect people with cardiovascular diseases. So almost every speciality, COVID would affect persons in different ways. And therefore, we need to recognize it early and be able to treat patients accordingly. So you will see a number of training programs along those lines being rolled out during the year. In addition to that, other workers, nurses, other ancillary staff, we also would be training them. And of course, one of the kind of routine training that we have all the time is infection control. So these types of training would continue.
All right. I will be remiss of me not to mention mental health because that was one major area that the ministry focused on coming out. Rather when you came into office until now, could you give us a little update on that?
Well, we don't have any specific training program that is ongoing right now, but that's something that we'll continue working on.
All right. You've mentioned testing a few times, so we can't talk COVID-19 and not discuss testing because our testing capacity has increased a lot. I know, firstly, I know last time I checked we only had 2 institutions that were doing those testing, and then I noted that there is a requirement now for a negative COVID-19 test in the US. But I know when we discussed it last year also, you indicated that the traveling aspect was not necessarily a mandate of the ministry. Could you speak to that a little bit?
So in terms of testing capacity at the National Public Health Reference Lab, we have increased that capacity, so we can do much more tests. However, it also, for us to do the tests, it means that we have to collect more samples. A PCR test is an expensive test, and it costs approximately 20,000 Guyana dollars per test. So every PCR test that we do, there is a big value that is attached to it. I don't think a lot of people realize that. So one, we want to make sure that the people that we are testing, and they really need to be tested. And therefore, we have sent out test kits across the country to our various hospitals and testing sites. And we have been encouraging people who believe that they have been exposed to come to one of our testing sites, and we'll do the test for them. In addition to the PCR, we do have the antigen test that is used in under certain conditions. And we have been getting good results with it once we use it in the defined protocol. So that we'll continue to do. Generally now we have been, over the last week or so, we probably do maybe about 350, 400 tests per day. And we are going to improve that, increase that once we get those samples coming in. So that's where we are in terms of our capacity. And we are constantly working to improve that. But we have to get people also coming forward to who want to be tested and who believe that they're exposed. So if people believe that, then they should come forward and we'll work with them. So that's one aspect. In terms of the laboratory that have been accredited, there are only 2 accredited laboratories right now, and that is the Eureka Medical Laboratories and the National Public Health Reference Lab. So these are the 2 laboratories that have been accredited in Guyana. There are other laboratories that are going through a process of being accredited, but they have not been accredited as yet. So I just want that to be clear to everyone. In terms of the testing requirement now for travel, about a week ago, I think, or 2 weeks ago, Canada has imposed a testing requirement whereby if somebody is traveling to Canada, you're required to have a negative PCR before you board the plane to go to Canada. And we've seen that now is a requirement for the UK. I think about a week ago they have put that measure in place so that if you're going into the UK, you also require a negative PCR testing. CDC last night has released information that as of the 26th of January, that the US would be requiring people traveling to the US to have a negative PCR test. So as you know, when we reopened our airport, we made it mandatory for any traveler coming to Guyana to have a PCR test. And what we have seen now is that many other jurisdictions now putting these requirements in place. I think it allows for safer travel, and so when you're on the aircraft, you know that you're by and large with people who are negative, so it gives the passenger additional comfort that they're traveling with people who are negative. But in some cases, we have detected, as you would know, that because the 36 hours PCR that we require, most people can't meet it. So there's now that period of up to 7 days. And if you're beyond that 36 hours, then you can, you'll have to do a second test upon arrival. And when we did that second test for a number of persons, we have found that they're positive, and therefore we had to take action. The US, I think their protocol is going to be that you have to get a test within the 36 hours. And after 5 days, while you're over there, well, you will be required to be in quarantine for 7 days. And you would also be required to do a test after 5 days of entering the country. At least that is what is being discussed right now. So these protocols are going to unfold, and therefore travelers going back to the US would have to make those arrangements to ensure that they comply with those requirements when they are put in place.
Okay, thank you, Minister. As we're on the subject of testing, our two main testing centers at Paradise, and then we have, of course, at Herstelling. Are there any others, or those are the two main ones?
No, we have a GPHC as well, so we are able to test at GPHC, and then at all the regional hospitals we have testing sites.
Okay, Minister, thank you. The question we have from Prime News, they're asking, can the ministry say how many children it has treated for the COVID-19 virus? And what are the age groups and some of the common ailments that you probably would have seen in the children?
So children generally would be asymptomatic, and we have said that, on a number of occasions. And the only reason why we have detected that there are children who are positive is because when we go to do contact tracing in a household, when you go into that household, there might be children in the household, and we would test everybody in the household if we believe that they would have been exposed to someone who's positive, and they would have had a long frequency of that exposure. And so we have been doing that, and because we have been doing that, we have detected a number of children who have come back positive. In terms of the age categories, from 0 to 5, we have 114 children who have tested positive over the duration since we have started. And between the ages of 5 to 9, we have 176 children. And between the ages of 10 to 14, we have 247 children. So, and again, we haven't had any serious ailments with children. Most of them were asymptomatic, and they were monitored at home, and basically they have recovered.
Okay, they have a follow-up question. They're asking, how does the ministry plan to treat with vaccination in children in particular?
Well, that perhaps is a very good question, because as we speak, the Pfizer vaccine, which was given emergency use authorization, and the Moderna vaccine, which was given emergency use authorization, cannot be used to immunize children. Pfizer's vaccine is for persons 16 years and above. And there's similar thing for Moderna vaccines, because they are mRNA vaccines. For Pfizer, they have started clinical trials for children between the ages of 15 to 12. And in another 2 months, they'll be starting clinical trials for children between the ages of 12 to 5. Those trials, the first one between 15 to 12, that one has started, but it's not completed, and because there isn't any data, that is why it's not allowed for children to be vaccinated at this time. And of course, the 12 to 5 age group, that trial is yet to be started. I think they will be starting that sometime in April. So as it is right now, this vaccine, there's no vaccine that is available for the immunization of children.
Okay. The questions from NCN, they're basically asking, it is the flu season, and they wanted to know the report from the medical facilities in this regard.
Well, the reports generally has been if you're taking the precautions for COVID, you would see a reduction in cases of influenza. And that is globally because the same precautions that you take for COVID is effective against influenza. And so they have seen reduction in some cases once people are taking these measures.
All right. They're also asking for an update with response from karfa to guide the request to test the variants here.
Well, I've said before, we have a relationship with karfa where we will be sending, if we so wish, at least 10 samples per month. So we have set up that partnership with karfa, and we'll be sending samples as is necessary.
Okay, Minister Anthony, thank you so much for engaging with us again. Thank you. Hope you have a good day.
Thank you.
All right, well, that's it for today's COVID-19 update. Of course, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy. And of course, remember to check our social media platforms and follow as well for frequent updates.